Managing pharmacy costs effectively is becoming as important as managing the underlying medical expenses. To ensure that our clients have a model that delivers both the lowest cost and the highest level of service, MMA has created a dedicated division focused solely on pharmacy management. Some common questions that we hear when discussing pharmacy strategy with employers are: how do I know I'm really getting the most competitive pharmacy benefit management, or PBM, arrangement for my company? Is there a way to audit my current PBM against the rest of the market? How can I ensure that my pharmacy strategy is not just helping lower costs, but also designed to help improve the health of our employees? Will I have to change my PBM or carve out my pharmacy program to find savings? Does my agreement contain performance guarantees that subject the PBM to financial penalties if they underperform? These questions are challenging and important for employers to consider. Data further reinforces the critical role pharmacy benefits are playing in the rising cost of healthcare. Drug spending within the U.S. is at an all-time high and expected to rise to almost $500 billion in 2016, an increase of 148% from 2005. In addition, pharmacy benefits represent 20% of employers' overall healthcare costs, and specialty drugs represent 40% of the pharmacy spend. To help employers combat the rising costs of pharmacy and drug spending, Marsh & McLennan Agency has launched MMA RX Solutions, a comprehensive service designed to help employers not only understand their pharmacy options, but to also help them maximize the bottom line savings. MMA RX Solutions is built on deep dive analytics headed by our actuarial and health integration teams, strategic partnerships with the pharmacy contract experts of RX Benefits, and a mobile employee engagement platform powered by MyDrugCosts. Savings can be generated without changing the PBM, plan design, formulary, RX network, or clinical programs. When attempting to rein in cost, employers are challenged with finding the lowest prescription unit cost and empowering their employees to become better healthcare consumers and make better utilization decisions. MMA RX Solutions addresses both of these components and thus increases the opportunity to experience savings. Part 1 of the cost equation is addressing unit cost structure. This includes the Pharmacy Benefit Manager, or PBM contract, discounts, rebates, and overall plan design. Part 2 of the cost equation is addressing utilization, or in other words, employee purchasing decisions, their choice of a generic versus brand drug, where the prescription is filled, and the level of engagement can have a major impact on plan costs. MMA offers the assurance that every component of the pharmacy contract is negotiated with optimal deal terms. We perform an extensive audit of the current arrangement and an analysis that goes far beyond what many PBMs provide. Our analysis of the current contract versus other market bids includes a detailed line-by-line comparison of contract rates, claims, effective rates, fees, rebates, and more. We also show utilization and potential network savings, as well as a targeted population savings. The claims are repriced based on our contractual standards, proprietary analytics, and market intelligence. We then review the results with you and provide recommendations. MMA RX Solutions includes MyDrugCosts to help employees make cost-effective decisions at the time of script. By arming employees with an easy mobile web application, completely unique to their plan, they are better prepared to make decisions to lower their costs and save the employer money. MyDrugCosts is easy to use and has a high adoption rate among employees. It's designed for real-time decision-making at the doctor's office or pharmacy. It enhances employer communication to employees about the plan, and it increases savings for the employee and improves the bottom line for the employer. Let's take a look at how the MyDrugCost platform works.
Welcome to MyDrugCosts, the easiest way to save on prescription drugs. How do you spell that? Mary asked her doctor. typing the first few letters of the drug into her smartphone, she quickly finds the drug Crestor. Immediately, she sees this is a brand drug without a generic option. Ways to buy Crestor are shown with her out-of-pocket costs for plan-specific and off-plan options. Ways to save are shown, including opportunities to switch to similar drugs. Employees can learn more with detailed drug quality information and employer-specific resources. Exploring similar drugs, Mary finds lower-cost alternatives to discuss with her physician. Consumer Reports' best buy drugs are highlighted. Together, Mary and her physician decide atorvastatin is a better choice. With a single decision, Mary just saved herself over $360 a year, while saving the company $2,200. My Drug Costs can also help employees during open enrollment. Compare costs for a single drug or a full list. See monthly or annual costs for each of the available plans. Employees can use this information to pick the right plan and to estimate how much to put into their flexible spending or health savings account. My Drug Costs, the easiest way to save on prescription drugs.
With MMA RX Solutions, we have established a model that meets the needs of both mid-size and large employers, thereby allowing for real-time access to eligibility and claim data, and ultimately having more control over the pharmacy program. With MMA RX Solutions, clients receive better cost and trend management through deep dive analytics, expert review and negotiations on pharmacy contracts, innovative solutions for employee engagement and communication, and overall, more control and customization of the plan and performance management of the PBM. For example, we ensure a dollar-for-dollar guarantee from the PBM on their agreed-upon pricing. Most importantly, it improves the bottom line. MMA RX Solutions clients typically see net savings of 10 to 20% on their pharmacy contract. The following case studies illustrate how MMA clients have experienced significant savings through MMA RX Solutions implementation. A solid waste company with over 2,000 employees approached their MMA service team with concerns about rising pharmacy claim costs and their potential exposure to the Affordable Care Act's Cadillac tax regulation. After a thorough examination of the client's cost drivers, MMA determined the per-employee pharmacy spend was well above benchmark for their industry. MMA recommended the implementation of MMA RX Solutions for a full evaluation of the client's current Pharmacy Benefit Manager or PBM and contract. The evaluation found the client's price paid per drug was higher than market, the rebates paid to the client were below market, and the pharmacy contract allowed the PBM too much discretion, both in terms of how it categorized drugs, but also how it priced them. Using the information uncovered through the MMA RX Solutions evaluation, MMA was able to negotiate with the client's existing PBM to improve their unit pricing, revise their contract to prevent reclassification of drugs to higher cost categories, increase rebate sharing, and implement an annual utilization review. The result for the client was $250,000 in savings and reduced exposure to the Cadillac tax, all without changing their PBM, pharmacy plan design, pharmacy network, formulary, and clinical programs. In our next case study, a hospital client with over 600 employees had expressed their frustration over the high cost of pharmacy and the level it had grown over the last 4 years. Their MMA service team recommended a full MMA RX Solutions PBM and contract evaluation. As part of the evaluation, MMA went to market to gauge how well the client's current PBM was performing. In going to market, multiple PBMs submitted bids with over $100,000 worth of savings for the client. Each bidder offered lower price paid per drug, stronger rebates, and contract terms to protect the client and ensure savings were truly generated. As a result, the client's existing PBM adjusted their contract and pricing to retain the case, saving the client over $100,000, including dollar-for-dollar guarantee on terms, and without changing their PBM, pharmacy plan design, pharmacy network, formulary, and clinical programs. When it comes to analyzing pharmacy spend, employers cannot do it alone. They need a trusted partner to help navigate the complicated pharmacy landscape. MMA and our pharmacy specialists are working with employers like you to take a more active role in managing pharmacy spend. Together, we can drive long-term savings and deliver meaningful results.